Hello, and welcome to another episode of Hematology Horizons. My name is Elissa Baldwin, and I'm the Director of National Patient Education at the Leukemia and Lymphoma Society. Today, we are on site at the Association of Oncology Social Work Annual Conference in Atlanta, Georgia. I am joined today by Carrie Panzer, a licensed social worker who specializes in grief, body image, and cancer treatment and survivorship. Thank you for speaking with me today, Carrie.
Thank you for having me.
Our episode today is on body image after a cancer diagnosis. At this conference, you presented to your fellow social workers about the ways that they can help patients and survivors deal with body image concerns. But let's start first with the basics. What are some temporary and permanent body changes that a patient might have due to cancer or the treatment itself?
Yeah, great question. Thank you. It's a good place to start. Some common temporary changes someone might experience might be, for example, hair loss due to chemotherapy. For some people, this is a really big challenge. For many, their hair is a big part of their identity or how they present themselves in the world. Another common change to the body could be numbness after surgery that eventually fades with time. Someone might be neutropenic for a period of time, and that too can pass. In terms of permanent changes, many people will experience perhaps infertility due to treatment. Some people are going into menopause and through menopause quickly because of treatment is another example. Other individuals might have to undergo an amputation type surgery or have scars or tattoo markings from radiation are other examples. And each of these more permanent examples can serve as a permanent reminder to somebody every time they see them on their body or look in the mirror as to what they've been through or what they are still going through, given the chronic nature of some cancer diagnoses.
Yeah, it definitely seems to be a pretty difficult issue for cancer patients and survivors. And in this talk, you talked about the new normal.
Yes.
Right? Which a lot of people just hate that term.
They do.
The new normal.
They don't like it always, but
I loved how you framed it in your presentation, that you really talked about it more being that you're not going to go back to the previous you, right? And you don't have to. You don't have to go back to what you were before, and you shouldn't have that pressure to be that same person and to look like that same person, right?
Sure, right. Good point. You said a few really important things. So I want to start with the fact that a cancer diagnosis and then the experience of treatment is really profound and stressful on so many levels, right? It is life-changing beyond appearance or changes to your body. I think historically, oncology and the treatment teams have been focused on survival or maintenance of, say, a chronic cancer diagnosis. What that does, though, is it leaves out this concept of the new normal, that then individuals are being asked to go on and live the rest of their life with these changes, but that's not often a part of the discussion when you have an appointment for follow-up or with your team. And so it's left out of that bigger dialogue. And so individuals are left to figure out, okay, how do I adjust to life now or the body that I'm living in if I have changes to how much energy I have or my fatigue levels? And so that is a challenge, I think, for a lot of people, and why it's important to talk to others that are going through the same thing, maybe talk with an oncology social worker. The other thing you talked about is, this pressure around maybe getting back to the way we were pre-cancer diagnosis or treatment, or maybe our body getting back to a place that it was pre-diagnosis. And the reality is, for a lot of people, there might not be a going back, right? There might be a permanent change, or maybe you're living with a chronic diagnosis where you have to make significant changes. And so part of I think really being able to go on and thrive in survivorship is being open to those changes and working around a process of acknowledging them and accepting them. And so it is a process. It's a practice to do that.
So in your presentation today, you discussed acceptance and commitment therapy, or ACT.
ACT.
And could you explain what that is?
Yes. Acceptance and commitment therapy is a model of therapy that a lot of therapists or oncology social workers, psychologists will employ when working with individuals, maybe couples or families. At a very high level, acceptance and commitment therapy is a mindfulness practice. And what it is doing is training the individual to begin to acknowledge and accept, so that's the A, the acceptance and commitment therapy, what is happening in their life so that they can then commit to what matters most to them. So the commitment I talked about, there is also a very important piece of this, which is values clarification. So when you're working with acceptance and commitment therapy, or ACT, a big part of that is the commitment piece is what are your top values? And when you're clear on that, you're better, able to commit to making choices to live the life that is of most meaning to you. And those could be small choices, right? Am I going to commit to resting today so that tomorrow I have energy to spend time with someone I care about? I can't do all the things, maybe. So I am going, because I'm acknowledging what really is happening here, this is just a basic example, but I am going to make behavioral choices to support me so that throughout whatever time span, or say a week, I can then have the energy stored up for what really matters to me.
So this acceptance and commitment therapy,
Right.
Is this something where cancer survivors need to go to a professional therapist, or are we going to learn some tips and tricks today that we might be able to show them and
Yes.
they can do at home?
Sure. I absolutely hope to impart some knowledge today, and actually an experiential exercise you can do on yourself. Of course, for many people, getting supportive therapies while they're going through treatment or well into survivorship, or if you're living with a blood cancer and you have, a chronic condition or diagnosis, it can be helpful to seek out therapeutic support. But there's also a lot you can do for yourself on a regular basis that will help ground you and really help you then make those commitments towards what matters most.
So you mentioned the different pieces of the ACT.
Yes.
And so the A is accepting your thoughts.
A is acceptance or acknowledgement. So accepting, or at least starting with acknowledging what is happening, all your thoughts, feelings, and beliefs. The C is about getting clarity of your values so you can commit to those values. And then the T in ACT is take action. So making decisions to support your top values. It could also be considered T for training. So training yourself in this mindfulness exercise that we're going to go through so that you can reduce stress in your life and then again commit to what matters most, no matter what phase you're at in your cancer experience.
One thing also that you mentioned in your presentation today was hooked and unhooked thoughts.
Yes.
And so what does that mean for cancer survivorship and body image?
Great question. So in ACT, there is the concept of hooked thoughts and unhooked thoughts. I'm going to go back for a second to the A in acceptance and commitment therapy, which is either starting with acknowledgement or there's the acceptance of what's happening. We are wired as humans through evolutionary means, our brains are wired to always be scanning our environment for threats and opportunities. This goes way back in time. The issue with this is that we tend to lump things into two categories, good or bad, black or white. So a big part of working with thoughts as they come up for us is working to unhook those. And a key component of that is something called psychological flexibility. It is a practice of starting to learn to notice when you're having a thought about something happening to you. Oh my gosh, I have to go through chemotherapy. This is going to be all bad, right? There will be no good in this. They're diametrically opposed. The goal with psychological flexibility is to unhook ourselves from these extremes of something is all good or all bad. Is there any room in the middle? Is there a possibility that there could be some blessings that come out of, say, a chemotherapy experience? So unhooking from really distressing thoughts can be a very powerful action, but it takes us recognizing our thoughts as they're happening. And the exercise that you brought up that we'll do together is a key component of learning a psychological flexibility practice and a way to unhook from thoughts that are difficult for you.
Now, you mentioned the exercise. I would love to take our viewers through a short exercise on something called thought diffusion, or an exercise to unhook your thoughts.
Unhook.
Right?
Yes.
Okay, so listeners, go grab a pen and paper and pause the video as you need to and come back with us in a moment and we will get started. All right, so I have my notebook here. I was taking notes during her presentation, and we are gonna all do this together. So as she's describing it, get your pen and paper ready to start writing. And so let's go through this step by step.
Okay, great. Again, this is a thought diffusion exercise, and that is spelled DEFUSION. We're working to unhook hooked thoughts that we have. So when I walked everybody through this exercise earlier, I had them pick a thought that might be common to someone going through cancer treatment or in survivorship. I don't know if you have an example that you liked that would be helpful, Elissa, or what do you think?
So when you were telling us to have a thought, come up with something that we believed, right?
Right.
And so I went back to the time that I was in treatment, and the best thing I could come up with that I remember so well was I am bald and not pretty.
Okay.
Because everybody got the moon face.
Okay.
And we had the moon face, and then of course lost my hair to chemo, and so that was the biggest thing that I didn't recognize that person in the mirror.
Okay, so let's work with this thought. And you can imagine each of you hearing this, that kind of thought running through your head whenever you look in the mirror or, just sense yourself is a pretty distressing thought, right? It can lead to feelings of self-doubt or a lack of confidence. And for many that have thoughts like this, they might also avoid certain activities, right? They might not go to something because they're not feeling good because they've lost their hair or they have a puffy face, for example, due to the medication they're on. So what I want us to do is, if you have a thought that comes to mind that's been playing through your head as a result of your experience, is write out that thought at the very top of your paper. So one that I use today in my workshop or presentation is, I am no longer attractive. Is that a fair sentence to sum up perhaps what you were feeling while you were in the throes of it? Okay.
Absolutely.
So this we did earlier. So if you could write out, each of you watching this vlog, that sentence, I am no longer attractive. The next step is I want you, and can you demonstrate this for everyone, is I want you to hold that thought that you've written on your paper right in front of your face. And what you can see is when a thought is fused right in front, and it's right in your face all day long, I am no longer attractive. What you find is it's very difficult to see around that thought. You're not noticing something that's happening over here, or your child's emotion over there, or maybe like something that needs attending to in your life, because you're so focused right here. And the other thing is, the longer you hold that up, do you notice, are your arms getting a little tired? They're getting tired. So it takes a lot of energy to hold a thought over and over in our minds. So now if you could put that thought down on your lap, just fully put it down. How does that feel? Does that feel any different to put that thought down for a minute?
Yes, it feels good. It's no longer right in front of my face. I can see the world around me now, and it's kind of out of sight, out of mind to some degree.
It's different, right? Mm-hmm. And I was just going like this, and I feel like I'm just breathing easier once I can put that down and breathe for a minute. Okay. So there's a couple more steps with thought diffusion. So the next would be to write out a second line below the thought. So you're going to write out, I'm having the thought that, and you'll put that directly below whatever thought you wrote out. In this example, it's I'm no longer attractive. what we're going to do is we're going to read those in reverse order. So it's going to be,
I am having the thought that I am bald and not pretty.
Okay. In the other example, I'm having the thought that I'm no longer attractive. Does that feel different to you when you put a little space there and recognize it's a thought versus that first statement feels more factual, which could cause some distress? But when you notice it as a thought, does it feel any different?
Yeah, it almost separates it a little bit.
Yes,
That
yes.
maybe it's not true.
Right. It's a thought. And again, I don't actually think I said this yet, but a core tenet with ACT is that your thoughts are just thoughts. Your thoughts are not fact. We all have thoughts running through our minds all day long. It's just the human condition. And you probably have heard the term, don't believe everything you think. And that's a saying for a reason, because thoughts are just thoughts. It doesn't make them true. And you are not your thoughts. Okay, so thank you for that. Now, the third step, and feel free to pause, is you're going to write something else below those other two statements, which is I'm noticing that. So go ahead and write that out. I'm noticing that. So in this example, could you start from the bottom and read up for me?
So I wrote, I am noticing that I am having the thought that I am bald and not pretty.
I'm noticing I'm having the thought, again, that I'm no longer attractive. Does that feel different? It gives it even a third step of pause.
Yeah.
I'm noticing myself having the thought. Does that feel any different to you?
That feels like it's even further separated. Like
Yes.
that is just a far away thought. It's not really true.
Right.
I'm just, I'm noticing that I'm having this thought now. And that I feel like that I can tamp down on.
Yes. So the reality is, so for many, you are bald, right, when you're going through treatment. When you translate that, I think what you were saying is, am I not no longer attractive? Because right now I don't have hair and my face is puffy, right, from treatment. But when you pause and you implement this thought diffusion, you can see that there's more nuance there, right? Many people, I would say, like, people are beautiful while they're going through treatment. Yes, you don't have hair. You're accepting that fact. And this exercise gives a little space to say, is that 100% true? Like, is this actually true?
It feels like it's very much distanced.
Yes.
And I can take a step back and think,
Good point.
Is this really true?
Yes.
Is this really what I feel?
Yes.
Is it going to get better?
And is this forever, right?
Yes.
Oh, no, this is temporary. I don't have to like it, but I'm acknowledging it's happening. I'm acknowledging, yes, that this is my reality, but it won't be forever, and I can work with that. The other funny thing is when you read those statements back, so I'm noticing that, I'm having the thought that I am no longer attractive. It's kind of clunky. It slows you down and gives a sacred little pause there to go, wait a minute, is that all true, or is there evidence to the contrary once again? So I do find it to be a powerful tool when we're really getting upset due to negative self-talk that isn't serving us, in terms of putting our energy where it matters to us.
Yeah.
Yeah.
So the final thing you spoke about in your presentation today was utilizing gratitude and activating your gratitude circuit. How can patients and survivors utilize gratitude to help with body image?
Gratitude is a really powerful tool in our toolbox. I recently read through a book called The Upward Spiral. It's a wonderful book. It's about brain science and how we use the practice of gratitude to literally rewire the way we think about things. Gratitude has been studied, and fMRI results show that when we practice gratitude, certain parts of our brain and brainstem light up, and actually dopamine is released, which is a feel-good chemical. And we have this ability to practice gratitude. It doesn't cost anything. It's available to us if we can put the commitment into a practice of it. The other thing is that a gratitude practice really helps us in the acknowledgement or acceptance part of acceptance and commitment therapy. When we can open up to what we are going through and acknowledge it's happening versus trying to deny it or run away from it, we have a lot more power to then practice gratitude. And so it can very much help in our acceptance of our situation. I am going through this, and while I can't maybe do, like I was just saying, this activity over here, I can do this. Or I'm so grateful that I have these strong legs that still enable me to take a walk around the neighborhood. There's individuals I work with that, they can hike, and maybe you can't do that. I mean, maybe you're grateful for something very small, for your breakfast in the morning, or the feeling of sunshine on your skin. No matter our life circumstance, we are able to tap into gratitude. The final thing I want to hit on with gratitude is that it is important to actually write, if you're going to, a gratitude practice is actually to write down whatever it is you're feeling grateful for. So many people will commit to writing down 2 to 3 things a day that they feel grateful for. And again, you can start very small. It could be the fact you have shoes to put on and that are comfy, right? I am so grateful that I have this resource in my life. Is that when you write it down, not just think it, but you think it, you could even say it out loud and then write it down. What that does over time is it does really start to rewire the way that you're looking at things. It can really change your lens. There's so many studies that in 30 days, if you could commit to do this, writing down 2 to 3 things once a day, you are going to feel like a different person, and that dopamine is going to be in your body in a new way, and that is definitely a feel good.
I love it.
Yeah.
Now, since our viewers already have your pen and paper, I would like you to write down something that you're grateful for.
Yes, great idea.
What are some suggestions? 2 or 3 things that they could write down? Does it have to do with what their body can do, or are they grateful for family and friends? Could it be anything?
It could be anything. I mean, it can be something really small to something very big. I'm grateful I have this roof over my head, right? Having a home is huge. Down to, like I just said, wow, I have these really comfy shoes that I have. Not everybody in the world has shoes. That's a wonderful thing. If you find you are struggling with feeling comfortable in your body, or even some people talk about feeling embarrassed about their body due to treatment, the diagnosis itself, physical changes, you might want to focus in on what you are grateful for in terms of your body and what it does for you. Honing in really what can I do versus really focusing on what can't I do. And so that gratitude just starts to flow. And you realize, wow, this is incredible, our human body, what it can endure and what it does go through with treatment. And here we are having this discussion.
Yeah, absolutely. So it could be things like I can walk.
I can walk.
I can cook food for myself.
I can snuggle
read.
with my grandchild.
I can snuggle with my grandchild.
Yeah,
or snuggle with my pet.
Yes, I can,
Yes.
Just the gratitude of the things that are still possible. Again, from something really small to something really big.
Yeah. So I hope, listeners, that you have written that down today. And again, Carrie, thank you so much for joining us and telling us all about body image. We hope that our viewers have learned something today. So for resources and support on cancer survivorship, please be sure to visit the link below. And thank you so much for joining us. We will see you on the next episode of Hematology Horizons. Take care.
Take care.